talking about health study. It was a 3-year study looking primarily at the way people self-manage. The purpose of the research was to really focus on how people live with their long-term conditions, because often we see the way people are treated is often around particular disease states. For example, they have diabetes, but what we know is most people have multiple long-term conditions, or at least a couple, and those really impact on the way they live their lives. So part of that was, how do they look after themselves? How do others help them to look after themselves? And what other caregiving roles and other responsibilities do they have? We were also really interested about the general practice team and how do they provide support to that person, provide education, provide what's needed in regards to their health care. Another thing we were particularly interested in is the general practice consult. So what does that look like for people? And that was amazing because it was quite variable what people reported. And finally is, how do people take and receive health information when it's given by practitioners, which again produced very variable results, with some people saying, of course I accept it because I paid for it, and I would seek advice from an accountant and they would give the information, so I would follow it. Whereas others often talked about the consultation having very little time to talk or participate, and that the questions at the end simply weren't enough to engage them, and so that they wanted more. And when it came to health advice, participants were really clear that it's much more likely that they take health advice from a practitioner, particularly if it's done in the context of they know the patient and they're making decisions together rather than being told what to do. We have a real responsibility to put the participant, the patient voice through, because often what health services do is they move along at usually quite a pace, thinking about what's actually needed here, not actually thinking about, so what's the service like from a user end, and what is it that people want from the practitioners and the health service they attend.
The research was based in the Mid-Central DHB, and we partnered with the PHO to do the work, and as part of the questionnaire we asked people whether they would like to make any changes to the consultations that they had with general practitioners. And one of the things that came out was the problems that people had with waiting time, and some of it is waiting time to see their own GP, who they would obviously prefer to see rather than a locum or no doctor at all, which is the case in some of the rural areas. But also waiting time in the waiting room to see a doctor or a nurse, and we feel that there could be some good use put to that time. Another thing that could be done is providing some information about who works in the practice, because I think that people aren't necessarily sure who are the doctors and who are the nurses and whether there are any other sort of allied health professionals there. One of the things is the importance of people having support to do the self-management that they need to do at home, because we know that they don't get very much time with a health professional, and the rest of the time they're on their own making decisions and choices which may or may not be good ones. But as much support as they can get from people in order to know what to do at home. Another thing to think about with people self-managing at home is that it's much easier to do things like exercise or dietary change or whatever if you've got company to do it with. And so involving the whānau in terms of making choices and decisions about food and cooking and shopping and things, and in exercising if you've got somebody who'll do the exercise with you, and that can be supported through maybe a local community group or something if people are aware that that sort of thing is available, or having somebody come and check that things are going okay for you.
One of the things I'm really passionate about is about self-management and self-management support. So often a lot of consultations, the key focus is on clinical management, and my real passion is about how do we help people to become better self-managers, and how do practice nurses, how do GPs, how do others in the general practice actually learn skills to support people more effectively. So some simple things would be such as ongoing follow-up, showing that you care, showing that you're interested in their goal setting and seeing how they're getting on. Other examples of good self-management support would be picking appropriate education material, for example some illustrations or diagrams to talk through with the client. Another key piece is about clients encouraging people to talk about what matters most to them and what is it that they want to achieve. Because when it comes to changing lifestyles and changing the way that you look after yourself, what we really know is you have to be ready, willing and able. And a lot of the time where we go a bit wrong with trying to encourage people to do things differently is we don't actually work out what's most important to them. Around self-management and self-management support, actually a lot of practitioners don't know how to do it. So whilst they do talk about it in their language, they're not really sure how they do it and how they do it within constrained time appointments. How do we do this differently? How do we coach? How do we educate? How do we support our practitioners that they can actually do this really important piece of work? Because I, for one, want it to be more than a concept. I want self-management support to be something that happens every day in our primary care practices, because that's what's going to help people to change the way they live their lives.